Hello and welcome to Employers Changing State of Mind, a look at the current landscape and how we can help ourselves and others. We will have time for questions at the end of this session, so please use the chat feature as questions arise throughout the presentation. Today's expert, Peter Freeburg, has a Master's of Arts and is a licensed professional counselor. He is a behavioral clinical strategist in Cigna's Behavioral Center of Excellence. Peter lives in Portland, Oregon with his wife and two daughters, ages 6 and 4. In his spare time, he enjoys being outdoors and exploring the Pacific Northwest. A fun fact about Peter, he's forced to watch every Disney princess movie and listen to their corresponding movie soundtracks from sunrise to sunset. Please join us in welcoming our Cigna Prince, Peter Freeburg.
Oh. I've never been introduced as a prince before, but I guess I will take it. I guess I'm a prince to my daughters, maybe, I don't know. Well, good morning, everyone. It's a pleasure to be here and talk with you today about mental health, the impact our mental health has on our everyday lives, as well as the growing need for behavioral health resources. As a therapist, like most other roles, this has been a very unique and challenging couple of years, but it's also been quite interesting and in some cases exciting. I am an optimist, and it has been exciting to see how services around mental health are evolving. With my current role at Cigna, I do have the pleasure of consulting with employer groups across a variety of different industries. And the appetite is there, the appetite for information and resources specifically on mental health. It has increased at a remarkable rate. And that has been very encouraging for me to see. When we were trying to think of a creative title for this event, really wanted to kind of give it a couple of different layers to encapsulate. Number one, mental health challenges exist within the employee population. We've always known that to be true, but the last couple of years have made it glaringly obvious. The mental health needs of employees have increased dramatically, and employers really can no longer overlook these issues. But then number two, from an organizational standpoint, the changing perspective towards mental health, as well as kind of more of a corporate responsibility that didn't previously exist of fostering a more connected workforce is changing, and it's changing for the better. So just to kind of level set here, look at how we have been impacted from a behavioral health standpoint over the last 2 years. Well, first of all, we know that statistically speaking, roughly 1 in 5 adults, so about 20% of the adult population struggles with a diagnosable mental health illness. Half of U.S. adults indicated that their stress levels have spiked throughout the pandemic. About 76% of full-time U.S. workers have reported experiencing at least one symptom of mental health in the past year. Now, one quick point of clarification, you can experience mental health challenges. In fact, we all will at several points in our lives when you're thinking about elevated stress, anxiety, or grief. Just because you experience that does not mean that you have a mental health illness. But if we are not adequately managing those emotions, it can develop into something later down the road. And it most certainly can and does impact our physical health, how we relate to others, and how we present ourselves at work. And you can see on the bottom left here, behavioral health causes more days of lost work than chronic medical conditions. In 2020, late 2020, Cigna released the Resilience Index report, and we had found that resilience, which is our ability to quickly recover from challenges, is at risk in 3 in 5 Americans. Low levels of resilience impacts us in a variety of different ways, but when you look more specifically at the workplace, workers with low resilience tend to have lower feelings of self-worth, self-esteem, lower performance, professional ambition. There is a higher likelihood for turnover. And what I find to be significant is that there are weaker relationships and a lack of community at work. And that is consistent with Cigna's loneliness studies that have found that the workplace is a major contributor to loneliness. So compounding layers at play here when we are all kind of experience that increased levels of stress, anxiety, depression, there is a decreased ability to cope with the unexpected changes, and there is a more disconnected workforce. So these are some of the reasons why we are seeing such profound levels of burnout currently, and what has been deemed as, the Great Resignation. Over half the country was looking for a new job last year. 26% of adults indicated that pandemic stress has made them less productive. And what always stands out to me, 46% of employees felt less connected to their company since the pandemic, since the start of the pandemic. Relationships matter. Our professional relationships matter. And experiencing those high levels of stress with that sense of disconnect from your employer or colleagues, that's a recipe for burnout. When you're pouring yourself into your work that seems endless, and you aren't necessarily getting that feedback for that work, perhaps you're feeling underappreciated or undervalued, which is because you're feeling isolated within your role. That's why many people have been evaluating their jobs and thinking to themselves, wondering, is this even worth it? So this is where we are starting to see that shift. More and more employees are vocalizing the need for behavioral health resources. Now, 1 in 4 employees have a more favorable view of seeking support for mental health since the start of the pandemic. And 72% of employees rate their mental health as an important influence on their total health. Now, while that certainly is encouraging to see, we still have a lot of work to actually get folks in the door. NAMI, which stands for the National Alliance on Mental Illness, NAMI actually indicates that the average delay between onset of mental illness symptoms and treatment is 11 years. I always like to repeat that for dramatic effect. The average delay between the onset of mental illness symptoms and treatment is 11 years. So despite, this positive trend that we're seeing, recognizing that mental health is important, there's still a lot of stigma and hesitancy to actually engage in treatment. And we actually see that those with behavioral health conditions are significantly more expensive when it comes to cost of treatment compared to those who do not have a behavioral health condition. And that is primarily due to comorbidity. So having a medical and a behavioral condition exist at the same time. In fact, within our own book of business at Cigna, we found that 92% of adults who have a behavioral health condition also have a co-occurring medical condition, and that's significant. Depression is one of the leading causes of disability worldwide, and it is often accompanied by medical conditions. So think of things like, chronic pain, low back pain, obesity, diabetes, cancer, heart disease. There's oftentimes depression as well as stress and anxiety that comes along with those conditions. So we really cannot be viewing the mind and body as separate entities that are to be treated individually, but rather it's got to take a holistic approach. Pre-pandemic, it was estimated that between 75 to 90% of all primary care doctor visits was attributed to stress. The body absorbs all of that stress. And if we're not effectively managing that stress, it does have the ability to deteriorate our physical and emotional health. So these numbers here that you see on the left indicate the value and potential savings associated with early intervention utilizing outpatient behavioral health services. So we found that those customers, we did about a 4-year study and looked through claims. Customers who had a depression or anxiety diagnosis, if they consistently attended outpatient therapy in that first year, they saved nearly $1,400. And if they went consistently for 2 years, that's $3,100 total medical cost savings. So we're seeing the financial benefit of outpatient therapy, but we also know the broader benefits, which as a therapist, I'm more focused on the broader benefits. So you're getting your needs met earlier. You are addressing real life concerns, and that will potentially translate to enhancing personal and professional relationships and a more productive workforce. So really, this is going to take a joint effort between health carriers like Cigna, as well as employer groups. We're doing some significant work to innovate ways in which we can identify behavioral health conditions, as well as work with our customers to get them into care sooner. but we also want to collaborate with employer groups to train and equip them with the necessary resources and information to kind of create that cultural shift within the organization to reduce stigma and ultimately build confidence towards mental health, where a manager can have a more meaningful conversation around mental health with those who report directly to them. And in turn, employees can feel more confident reaching out and asking for help. So first with Cigna, what are we doing in this space? Real quick answer is we're doing quite a bit. There are a few key areas in which we are innovating. The first of which is we're using predictive analytics to help find and detect our customers earlier in their behavioral health journey. So how are we doing this? With our integrated approach with medical, behavioral, and pharmacy, we get so much valuable information and the full story of the customer's treatment journey. So we can see through medical or pharmacy claims who might be at risk of developing a mental health condition, and maybe they don't necessarily have one yet. So there are ways to predict this. As I've mentioned, there are certain medical conditions that we see, like heart disease, cancer, diabetes, that does have that higher likelihood of developing into behavioral health disorder. So what we're going to do is through these claims, we're going to identify and outreach. We're actually going to have clinicians outreach these customers, and we're going to screen them for acuity. So we're going to look at what is their medical need, what are their behavioral needs, are there any needs present within the community, and from there we're going to offer appropriate referrals and resources, both internally and externally, for that customer to engage in. So if they choose. But then we're also going to see through claims who has a depression diagnosis, who has an anxiety diagnosis, and we can see if they are seeing a mental health provider or not. So if you were to look at pharmacy data, for example, many people get their prescriptions for an antidepressant or an anti-anxiety medication. They get that prescription through their primary care doctor, but they're not necessarily seeing a mental health provider in addition to that. Research really does suggest that medication and therapy has the best outcomes for treatment. So we want to outreach these folks and provide them all of the information and resources applicable to what's within their benefit plan design. We want to give them everything up front. We're going to email them and say, hey, this is what we have, XYZ. If you need any additional assistance or resources, give us a call or engage on mycigna.com. We also offer a variety of resources depending on the needs of the customers. If someone might be struggling with a behavioral health challenge, but perhaps they're not ready for therapy, or therapy might not even necessarily be appropriate for them at that particular point, they can utilize a variety of self-guided tools or coaching and support. But if their needs are not being met in that capacity, we have a variety of clinical programs to assist, one of which is our 24/7, 365 crisis line, really to kind of support our customers. It does not matter what time of day. If they're in crisis or experiencing some form of distress, perhaps they're considering treatment and looking to be admitted to a hospital, they can call us and we can help triage the situation and make appropriate referrals. Also, we want to help make it easier for customers to get into care. So, when it comes time to say, hey, I'm ready to see a therapist, but I don't know where to look, or I've called a few folks, can't get a hold of them, it can be frustrating. If any of you have tried this process, you probably can relate. And so you're going to potentially quit looking all around. And so we want to avoid that. We want to take the burden off of you. And so this is an additional way that we have been innovating, is we want to make it easier by taking some of that legwork off. We will do the work for you if you want. Not everybody wants us to help. We will call our network of providers and connect them with a therapist who has the soonest available appointment. On top of that, we're going to follow up with the customers that we assist finding that provider, because a lot of people quit therapy early. The numbers kind of fluctuate. It's estimated about 25% of people drop out of therapy prematurely, and there's a lot of variables behind that. Maybe the individual goes to therapy, they have a different idea of what therapy is. You'd be surprised how many people think that they can be cured after going to a therapist once. I appreciate the power that they think we have, but it takes a little bit more than just one session. Maybe not, but maybe they just don't have that connection with a therapist. There is a therapeutic connection that does need to take place. So if people don't necessarily get what they're looking for, they just quit after that first session. We want to avoid that. We want to keep you in therapy as appropriate. So we're going to follow up with you and say, hey, did you like that session or not? If you didn't, let's help you find an appointment with another therapist so you can get your needs met elsewhere. We've also been working extremely hard, and this is kind of where a lot of exciting innovations have been happening, particularly in the behavioral health space, particularly around virtual therapy. So we have been building out and establishing very strong partnerships with a variety of mental health provider groups. Virtual therapy is here to stay, and we are actually seeing tremendous value in virtual therapy. Within our own network of providers, our providers have indicated to us in surveys that their clients are more consistently attending therapy, as well as disclosing more information in the virtual space. You know, in the early days of the pandemic, a lot of mental health providers, myself included, were quite worried that the quality of therapy would be diminished when it's done in a virtual format. But we've actually seen the opposite to be true, especially as more and more providers are adopting to the virtual care model. Additionally, this is a huge benefit for our customers. I can tell you when I was in practice, so many excuses why people would not show up, they'd last minute cancel, or they would not reschedule. So many excuses, whether it's the weather, the time of year, oh, you know, we're going into summer, so my kids aren't in school, or now we're going into fall, so my kids are going into school. A lot of excuses, price of gas, gas price, or I worked late. So people would just quit. You know, therapy would be the first thing on the chopping block that they would not attend. But this virtual component is really removing most of those obstacles, and people can see a therapist in a more convenient manner at a time of day that works best for them, as well as the provider. You're removing all of that commute time after your long shift, and depending on where you live, that's a huge benefit, whether you're in a densely populated urban area, or maybe you're in a more remote area where it's a long drive time between you and the therapist. On top of that, you now have the option of leveraging the entire state's worth of providers. So historically, what we would often do is we would look for a therapist within a 5, 10, maybe 15-minute drive of our home. And now virtually, it does not matter. As long as that therapist is licensed and sits in the state in which you live, you can see them virtually. So that is also a game changer. And so just for perspective, some quick numbers. In 2019, enterprise-wide, we had about 55,000 total virtual visits in behavioral health. In 2021, we had over 6 million. And so when you compare 2022 versus 2019, it's over a 10,000% increase. So as a remarkable increase in just a short amount of time. And even with, you know, depending on where you live, you know, a lot of states are open now and people are more comfortable seeing providers face to face. Our customers are still choosing virtual, but now you have more flexibility of if you want to leverage a therapist, you can see them face to face, but also virtual. This is a game changer in terms of keeping people more engaged into care. So what you're seeing here is sort of a spectrum of sorts of digital tools and virtual therapeutic options that are available to our customers based off of their need. And some of you, I'm not going to go through all of these extensively, and some of you may be familiar with some of these names you see here. Now that I go through this, I just want to call out that Happify has been renamed as Twill, but this is available for our customers on the medical plan. If they're not quite ready for therapeutic intervention, but they want some sort of engagement with behavioral health, they can leverage self-guided digital resilience tools. One of the biggest innovations that I personally believe has happened is our new access to peer coaches, and you can see that through Ginger. Peer coaching is an invaluable service, and real quickly, peer coaching is not therapy. Peer coaches are not licensed therapists, but they are nationally certified to become peer coaches. So think of them as guides on the side. And so this is really what a lot of people need. Maybe they're stressed, anxious, maybe they're grieving, but they don't necessarily need to see a clinical therapist, but they need to engage with somebody. This is an added benefit with a peer coach. We can kind of put them through the coaching model first, and if that's not working for them, they can step up to more clinical interventions. And so we really want to give our customers choices, whether it's something self-guided, maybe it's peer coaching, which are shorter sessions, much more affordable, as well as a variety of different mediums in which people can engage with a clinical therapist in a virtual setting, whether it's through text-based, which is what you would see through Talkspace, or another treatment model. One thing that I want to end on here, because I know we just have a short time, I mentioned, this is kind of going to take a two-pronged approach. We need kind of buy-in from corporate, organizations, as well as, what we're doing at the health insurance level. But I have mentioned that delay between onset of mental health symptoms and treatment is 11 years. A lot of variables exist that cause that delay. Stigma is the biggest contributor, I believe. Employers are evaluating and purchasing several behavioral health resources and vendors, but some of these solutions are still being underutilized. This really stuck out to me. Headspace Health released an article this year that indicated 40% of employees do not believe that their employers even offer mental health benefits. I'm going to say that again. 40% of employees last year did not believe that their employers even offered mental health benefits. That's significant. Now, from my position, I know that not to be true, but there is some sort of communication breakdown happening somewhere. One of the things that this pandemic has highlighted was a fractured way corporate America has been operating and viewing mental health. In many instances, this fell on the lap of human resources. They're the only department who knew what resources were available. They fielded all of the challenges associated within an organization if someone was in crisis or needed some sort of mental health intervention. And depending on the organization, it's a very small team, 1 to 2 people expected to manage all of that for thousands of employees. And so what we've really wanted to do, and we've brought this to the table, is we want to walk alongside our organizations, and we want to help train you in meaningful ways. How can we understand mental health? And this goes beyond just HR. Let's partner with C-suite individuals. Let's partner with other managers within the organization of whom employees directly report to them. Let's give them the confidence and the skills that they need to have some of these more difficult conversations. So we have created a variety of presentation topics that can be utilized for the whole organization to listen to. We've provided or created more specific trainings, whether it's a 1-hour mental health awareness training, or if it's more of a 3-hour intensive mental health training specifically for managers. This is one of the best ways that we can move the needle. That 40% of employees who don't know that they have behavioral health benefits, well, one of the reasons why is because the conversations are not happening within the organization. So if we can change that, and we can help employees trust their company more and create a more connected workforce, that's really is what's going to help drive, this changing state of mind moving forward and getting folks into the care that they need. So with that, I know that was short, but we do have time for Q&A. And Deb, I don't know if you just are going to monitor that and siphon questions through to me. You let me know, but if any questions come through the chat, I'd be more than happy to answer.
I do have a couple questions. You may have, you addressed it just now, but wanting to make sure that you may want to add some color. The question is, the role of the employer seems to be shifting in regard to employee health. And maybe it's beyond this, but how does HR become more of a trusted source and access the knowledge we need to be a proactive support system for employees' mental health needs?
It's a great question, and just to kind of go back, this is exactly what we want to do. Is we want to partner with HR. We want to help HR evaluate, well, what is the culture of this organization? How do we talk about mental health? How do we address mental health? I can't tell you, I've been a part of countless events within companies where we've had, fireside chats with C-suite level of employees. I won't tell the name of the client, but there was a fantastic panel that I was a part of where it was a CEO who was asking questions with me. We're just having a discussion around mental health. there was 900 employees listening, and the CEO and other high-level managers were actually, they're being a little bit vulnerable, not overly vulnerable, like I have X diagnosis, but like just talking about some of the challenges that they have felt. And the feedback was just overwhelmingly positive, where you had folks who were listening saying, man, it's just so refreshing to hear my boss's boss's boss talk about this in a more transparent way. And so how, what's the cascading effect of that? How can we, equip those managers? If an employee comes to a manager, oftentimes the manager says, we'll go to HR. And so there's that disconnect, there's a relationship disconnect that happens there. And so when we're talking about certain trainings that we can do, partnering not just with HR, but with other managers to get their buy-in, it's not going to happen overnight. But it really is kind of a slow, steeped approach where eventually, culturally, that shift is going to happen towards this is a place that supports mental health. And not only do we support it, but we're willing to have some of these conversations, and hear you out, listen. There's no repercussions if you talk to me about depression. You're not going to get fired, this, that, and the other. And so again, it just takes time to kind of change and shift that mindset.
One more question in our brief time together. There are those who are more comfortable with face-to-face mental health visits. Will Cigna providers soon return to the more personal model?
Oh yeah, they already are. And one of the things that that we have been seeing, particularly in 2022, is the bulk of the virtual utilization is with our own network of providers. And so what people like to do is that flexibility. Now, some therapists, obviously, there's people out there who, I know anecdotally, I know some people personally where they go, I am permanently virtual. I'm carving out a space in my basement. That's my home office. That's all I'm doing. Because they feel less comfortable. But there are many providers who do want the face-to-face, but they also are offering that flexibility. So short answer is yes, absolutely. Therapists are more than willing to go back in person. It all depends on the relationship, if there's any type of history already there. But there's that flexibility is really the game changer now.
Wonderful. And with that, we will close right on time. I do want to share that we will send the presentation and the recording to those in attendance in follow-up. We appreciate and value your time, and we wish all of you well.
All right. Thank you all.